Hello, welcome to the Caregiver Question of the Week. Today we have a really good question. This came in from someone who has Parkinson's disease, but honestly, the answer to this question is super applicable to tons and tons of people. The question was, if you're preparing to go in for your first therapy visit with, in this case, it was a therapist who's a specialist and working with Parkinson's disease, then what's the best thing to do to prepare for that to make sure you get the most out of the visit? So really great question. I think that this is going to be an answer that I hope will be really helpful to a lot of people. And honestly, it's an answer where this answer applies to anyone who is about to see a therapist, an occupational or a physical therapist. Of course, for really any reason, this is going to be valuable information for any of those folks. But first, my name's Amelia. I'm an occupational therapist. I am also the owner and founder of Higher Standards Caregiver Training, as well as the very proud co-founder of WCN University, that's Whole Care Network University. And this Caregiver Question of the Week is for educational purposes only. So if you hear anything that makes you think of someone, maybe even yourself, that you think needs to be seen by a licensed healthcare provider, then please make sure you or that person is going to see your own personal or their own personal licensed healthcare provider, as this is not a substitute for health or medical advice, and it is not a therapeutic relationship. It is education. Okay, so if you are going in to see a therapist for an evaluation, and honestly, this is something you can think about. It doesn't just have to be for an evaluation. You can always be thinking about going in about these things when you're going in for a therapy visit. But very specifically, for a very first evaluation with an occupational therapist or a physical therapist, certainly I'm an OT, so that's what I'm going to answer more specifically to. But I think that probably most physical therapists would agree that this is helpful information to bring along before you go into a therapy evaluation. So one of the things that the therapist should ask you is what you want to get better at or what you are having problems with. And I'll tell you that the number one answer that I get when I ask someone at an evaluation, okay, so what do you want to work on? What do you think is the biggest problem? The number one answer that I get is walking. People say, well, I want to walk better. And my question back to them is then, okay, that's fantastic. Why do you want to walk better? What do you want to do? And that can actually be a harder question to answer than most people think. So here's my suggestion for before people go into an occupational therapy or a physical therapy evaluation, to prepare for it, to make sure that your therapist is able to do the best possible job that they can for you, and to make sure that you are getting the most out of however many therapy visits you end up having. And this is a really simple suggestion. So just like you might keep a list of your questions for a doctor before you go into a doctor's visit, which is a great idea, because of course the doctor walks in, we all get white coat syndrome, and then we forget what we're going to ask, right? So just like you might keep a list of questions before the doctor comes in, you want to make a list of all of the things that you're having trouble doing before you go in and see the therapist, if you can. And so this doesn't, again, don't think about like, well, I'm having trouble reaching up over my head. I'm having trouble walking. I'm having trouble doing those kinds of things. The therapist is going to figure all of that out. Instead, bring a list of all of the actual activities that are troublesome for you, or that you are not able to do as well or as safely as you would like to. And just kind of start by making a list as you go throughout the day. Like, oh, it was hard for me to wash my hair. It was hard for me to put on my shoes. I'm not able to cook as well as I normally would. I get tired when I'm out for a walk. Or I just don't have enough energy left at the end of the day to play cards with my friends. Whatever it is, make a list of those activities or functions that you're having trouble doing or that you are not able to do as well as you would like, and bring that into the therapy session. And that's going to do two things for you. One is it's going to help make sure that your therapist is targeting your goals towards the things that are truly meaningful for you to do. Two, that list is actually going to give your therapist a lot of really helpful information that's going to tell them more about exactly what might be going on with you. So it's not just about thinking, okay, well, these are the functional things that we want to address. Although, as an occupational therapist, my primary concern is always looking at what do you want to do and how do we help you do that thing, right? But it also gives a lot of information about what some of the underlying issues might be, what some of the trends are, what some of the patterns are, what other services or interventions that you might need. It's a lot of really, really helpful information that's going to make that therapy evaluation really valuable to you. So thank you for that very wonderful question. I hope that was a helpful answer, and I hope that it was helpful to really, truly, not just folks with Parkinson's, but anyone who is looking at going to get an evaluation with therapy to help make sure that you get the most and the best that you possibly can out of that session with whatever therapist you are seeing. If you need to submit a question, you can do so completely privately using the form that I'm going to post along with this video. If you don't see it in the top section, then look in the comments section below for that link to submit your question privately. You can. Otherwise, if you wanna go ahead and just ask your question in the comments, you absolutely can. Please make sure that you tag me so that I get a notification that you asked a question. Until next time, though, guys, please make sure you stay happy, stay healthy, and most of all, take care. Bye.